Oh my God, the time has finally come for me to do the full video on acute pancreatitis. Oh my God, I've been so busy, y'all, because I have a patient who thinks the CIA is drilling in his back and he feels like he can benefit from gabapentin, which is also called Neurontin. So when I get to pharmacology, we'll talk about that shit too. Okay then. So anyway, let's talk about acute pancreatitis. So before we get started with acute pancreatitis, first let's talk about pathophysiology. So I feel like a lot of times people jump into studying and they don't take the time to study in segments. So there's research to prove that if you chunk things together and study in segments and organize your thoughts, it'll be better for you to retrieve the information when it comes times for you to take tests on a specific disease process or the NCLEX. So anywho, let's jump into pathophysiology. So let's first talk about patho. So pathophysiology. So you have patho, then you have physi, and then you have ology. So patho, what is patho? You need to know what patho is before you take any course. It don't just have to be medical. You can actually use the way that I'm teaching you guys these study skills, how to use these control process to retrieve any information in any course study that you take across the board. It's definitely generalizable. Understand, I am the nurse with the verse that curse. Thank you. Sometime I'm ashy at work. It's a little ashy, but whatever. So patho is disease. Physiology is like function, like something's going on. You know what I'm saying? Functioning, changing things, physics, and then ology. Ology on any word is the study of. So basically, if you put all that together, and sometimes it don't make sense, but you gotta have enough common sense to flip it in your brain. Like you have enough common sense, even though ology, the study of, is at the end of the word and disease is at the beginning, which is patho. You need to be able to say the study of diseases, the study of disease changes in the body. That's what pathophysiology is, okay? So now, since we're done with that, let's jump into this acute pancreatitis. So the overview that I want to do about acute pancreatitis is that when we do each disease process that I do with you guys, I'm gonna go through everything with y'all as far as the function of the organ as it functions normally, and then when it becomes disease and what is affected. But the most important takeaway, the objectives that you need to know in this course, Patho from A to Z, come and learn about the disease process with me, is what you need to do as a nurse. What you need to do as a motherfucking nurse, okay? That's all you need to know. I get so many nurses and I train so many nurses, they be looking at all kind of stuff. First of all, bitch, all you got to do is look at the disease process. When you look at that disease process for acute pancreatitis, and I'm not adding all that fluff. I'm jumping straight to the point for you to be able to know what to look at and take your test and pass your test, okay? So nursing intervention, what you're going to do as a nurse, because I might as well just go ahead on and say that first, because you're going to be a nurse taking care of patients with acute pancreatitis. Think about what's going on. Pancreatitis. So let's go through acute pancreatitis before I tell you the main things that you're going to always focus on as it pertains to what to anticipate when patients come in with acute pancreatitis. First of all, acute, what does that mean? Sudden, all of a sudden, bow, here you go, you're here, you're inflamed. Something inflamed your ass, something inflamed that gut. That gut is on fire. You understand? And then you got pancreatitis. So pancreas is the organ. Anything with the ISITSTIS, that's a condition. A condition. That's a Freudian slip, just so you guys know. Look that up, motherfuckers. But what I was about to say was anything with the ISITIS, y'all get what the fuck I'm saying. When that's at the end of the word as your suffix, that means some type of condition, a process is going on. Inflammatory process, okay? So now you got it. Acute pancreatitis, okay? So now that y'all know what acute pancreatitis is, it's just that the motherfucking pancreas is inflamed. It's on fire. It's swollen. It's big. Okay? So let me ask you a question. If it's big, this is how you critical think as a nurse. If a patient is coming in, and just so y'all know, FYI, everybody come in with nausea, vomiting, and diarrhea. If you taking a motherfucking test and you need to know signs and symptoms for anything that's acute, just put nausea, vomiting, and diarrhea, okay? Them is like warning signs. Just like the skin is our first line defense, which is also our largest organ of the body. That's our first line defense. So everything has a defense, mechanism to try to protect us. So anywho, like I was saying, acute pancreatitis, if the stomach is swollen and everything go from whole to whole, do you want this patient to put anything in their mouth? Hell the fuck no. So what they gonna be? Nothing in the mouth. So that's going to be NPO, but you're not going to tell your patient NPO because them motherfuckers don't understand what no damn NPO is. You got to literally tell them, you can't put nothing in your mouth. You can't eat. Strict orders. You got to rest the gut. Okay, that's number one. Once we rest the gut, get a gut time to help decrease the inflammation, you're also going to get them pain medicine because they're going to be hurting them real bad, because you got to understand, inflammation is acting on the receptors, pressing down on the receptors in our body, sending pain impulses to the brain. So as long as that's going on, they thriving, they in pain, so they're gonna get pain medicine. Usually the fucking drug of choice is morphine. Okay then. So then after you give them NPO, nothing in the mouth, make sure you educate your patient and you're telling them, listen, you can't put nothing in your mouth. We're trying to rest your gut. That's the education for them. If they ask you for pain medicine, listen, pain medicine, the pain is what the patient said it is, okay? I'm looking for that shit for y'all. The pain is what the patient said it is. Now where that shit at? Because I got it on this motherfucking shit somewhere. Because y'all thought that I really was about to hold all this shit up in my motherfucking head. I'm trying to make sure y'all get everything that y'all supposed to get. And I can't do that by trying to like hold it all in my head. Even though I could tell y'all a lot of stuff off of the top of my head. But I rather just make sure I cover everything. Pain is going to be subjective. It's basically going to be what they tell you. So a patient pain is whatever they say it is. Okay. So you're supposed to ask them on a scale from 1 to 10, how would you rate your pain? So you can know what medicine to give them. Because a lot of times I train new nurses and they just be giving pain medicine. They don't even see that there are ranges. Now, let me explain something to you motherfuckers. If y'all out here giving pain medication and you're not giving it within the range could be 1 to 3, 4 to 6, or 7 to 10 for severe, okay? According to the standards and the guidelines. So when the doctors put those orders in, they put them in like that for a reason, because they're following a guideline, okay? So if you're giving medication for pain of 4 to 6, but you give it something 7 out of 10, you're operating outside of your scope of practice. Now you telling the whatever board, state of nursing, wherever you at, that you the doctor, that you the one, that you doing what you supposed to do as a medical doctor, when really you are RN, baby. Stay in your place. Don't do that. Make sure you look at the range. Make sure you use your PQRST, all that dumbass shit, to assess the pain. Where is that? How it feel? The description, all that, that's all a part of what we do. And people just thinking like, oh, when they see us doing it, like everything is so easy. Just for this one patient, I have explained tons of shit to y'all just now. And I ain't even make it into the core of everything else that I need to tell y'all. So back to what I was saying. NPO, nothing in the mouth. Pain medication. Morphine is usually the drug of choice. And what else do you want to do? The patient got nausea, vomiting, diarrhea. Not all patients with acute pancreatitis come in with nausea, vomiting, and diarrhea, but you do want to give that patient fluids at 125. Now, if you got a patient that come in with acute pancreatitis and they got heart failure, listen, I don't know what to tell you. You got to ask the heart failure team about that shit. Now, I'm just playing. Usually they make adjustments, okay? But other than that, just hypothetically speaking, let's just say we strictly speaking about acute pancreatitis patient with no other comorbidities. So with that being said, nothing in the mouth, pain medicine, and normal saline, isotonic fluid, meaning, bitch, I stay where you put me in the vascular space. I don't go nowhere else. If I put you there, you stay there. That sodium chloride, That's sodium chloride. So that's the shit that normally runs through our body, but it is treated as a medication, just so y'all know. So NS at 125, running on a pump. Thank you. So you can help correct some of this. Now, let's get into the pathophysiology of what's going on. So the pancreas is responsible for digestion. Remember I say everything is from whole to whole. So in a whole, out a whole, that's digestion. Now, how many days it takes depend on how fucked up your stomach is and what you do with your lifestyle. But whole to whole. So anywho, if the pancreas is normal digestion starts in the mouth, because you have enzymes that break everything up before it even goes down your esophagus. Y'all, people who got nasty minds, don't think like that right now. This is a conducive situation where we're trying to learn, okay? So it's going to go in your esophagus, down your esophagus. It's going to go in your stomach, okay? And the pancreas and the stomach. So here the stomach and the pancreas sit posterior to the stomach. So you need to learn anatomical positions too, because outside of the hospital, you can talk however you want, but when you're here, everything has a language. Everything has a language. Everything has a magic number. Everything has a drug of choice. Remember that. So anytime you're thinking about a disease process, always think about magic numbers, classic book signs, and magic numbers, and what else I said? Drug of choice. Y'all thought I was gonna forget, motherfuckers, but I know. So anyway, let's talk about so what happens? So what happens in acute pancreatitis? But before I tell you what happens in acute pancreatitis, let's talk about the normal function of the pancreas. So the pancreas help regulate digestion, insulin, and all that type of shit, okay? So we have something called, I called it the isolates or longhorn, but y'all know me being from the South, being from New Orleans, I'm gonna fuck up all the words, okay? But it's actually called isolates of longhorn. I just asked the physician how to pronounce it. I still ain't even pronounce it right. He say, shit, that's close enough. So anyway, what happens there? You have an endocrine system, okay? So there you have alpha cells, beta cells, and then you also have F cells. These cells are responsible for digestion, but in different ways. So let's talk about the alpha cells. So what does the alpha cells do? Alpha cells secrete glucagon. So glucagon is actually stored. That's your last line of defense. Glucagon is actually stored in the liver also. If you need to pull sources to kind of turn one thing into something else, so you have things called enzymes. And I know y'all learned in chemistry, y'all was probably sitting there talking about, oh, I'm never going to even use this again. Yes, the fuck you are. You're going to use catalysts. Yes, there's a catalyst. It speeds up things. And then things are converted. So what happens is glucagon is converted into glucose. So that's from the alpha cells. So the secretion of glucagon in response to when the sugar is low. So when the sugar low, bitch, you're about to go. Sugar high, you ain't gonna die. Thank you. That's a whole nother story. I just wanted to throw that in there since I'm the nurse with the birthday curse. I'm always be giving y'all little ones and twos so y'all can remember for y'all tests. Y'all shit that y'all need to know to pull up out that long-term memory. So alpha cells secrete glucagon when the sugar is low. So when your sugar is low, the alpha cells gonna help bring the sugar up. Okay, beta cells. Them beta cells, B for the beta, B for the best. B for the best, and you know the rest. So the rest is beta cells. So alpha cells, beta cells, and F cells are all a part of this umbrella called the isolates of longhorn. But I call it isolates of longhorn. Y'all tell me which one sounds better down in the comments, okay? But anyway, there are other cells there, but we're going to focus on these specifically for nursing, okay? I'm not going to even put nothing else in y'all brain that don't even really fucking matter. So anywho, beta cells. Beta cells produce and release insulin. So it produces and releases insulin. So when it releases insulin, That's after you eat. You know what I'm saying? It kind of helps regulate glucose. And what is glucose? Glucose is sugar. And usually when people have diabetes, even though I don't want to get deep into diabetes, but that shit is supposed to be inside of the cell. But when people have diabetes, the sugar is sitting outside of the cells. That's how they're able to prick it and get a actual number, because your cells are starving. You think you're eating and you're feeding yourself, but you ain't feeding shit. You understand? That's why diabetes can be real complex, just like acute pancreatitis could be real tricky. So anywho, the beta cells, they produce and secrete insulin. So I want to tell y'all something. This is usually how I study to remember things. When you chunk things together, and it makes it better for recognition, and it makes you a better competent nurse. So what happens, sometimes the body will attack itself. Like little kids get viruses sometimes. You can even get a virus as an older adult. And what it does is it wipes out the beta cells. And if it wipes out the beta cells, then guess what? That person is automatically a type 1 diabetic. Because they not secreting no insulin, so they're going to be insulin dependent. That's one of the things that could possibly happen. That's one of the things that could possibly happen in the immunity, type thing. It try to help you out, but in the process of helping you out, it had to wipe out your motherfucking beta cells. So now you don't have no signal to secrete no insulin. So you're going to need an exogenous source. So let's go back to prefix X, meaning outside source, because you don't endogenous make it inside, if that makes sense. So the next cells is F cells. F cells is just responsible for controlling and regulating appetite and digestion. Just put it at that. So the main important ones was alpha cells and beta cells. So alpha cells secrete glucagon. When the sugar is low, turn that into glucose. Glucose is also used for energy for the cell. So usually when people sugar low and they about to go, they usually motherfucking tired and about to die. I'm back. You see how people be interrupting me? I'm at work. You see all that shit. But guess what? Let me tell y'all something. This is also supposed to be inspirational and motivational to you too. So there is never going to be a perfect time to start anything, okay? The perfect time is just for you to start. Like, you just need to start. And I don't know who the fuck this is over here pushing out this ice, because ain't nobody in y'all. So whatever. Just let it keep on going. Long as the person or whatever it is, that the entity that's doing that don't fuck with me, because I do fight ghosts. So anyway, like I was saying, there's never going to be a perfect time, and nothing's ever going to be perfect. Do you understand that? So if you have a desire, a burning desire to actually do something, just go ahead on and get started. Yeah. You'll thank me later. So anyway, let's go back over everything that I have already discussed, because before I was rudely interrupted. So the normal function of the pancreas helps with digestion and glucose regulation, insulin regulation after you eat. Okay, there are alpha cells, beta cells, and F cells, which are also called the isolates of Longhorn, that helps with when the sugar low. Alpha cells help bring the sugar up because it secretes glucagon. Beta cells secrete insulin after you eat to help bring all them big ass fucking carbs us big bag bitches done ate down. F cells is for digestion. Secrete some type of pancreatic peptide, okay, which helps break down all that shit so it could go from whole to whole. So we eat it, chew it, digest it, and we shit it out. You understand? So that's the normal function of the pancreas. And then when it's inflamed, just think about it. If glucagon is being secreted, digestion, if it helps with digestion, glucose, insulin, all those things, think about it. Now, if the pathophysiology of it is, if it's inflamed, then what does that mean? That means that none of those processes will work like they need to. So people can have high sugars, people can have low sugars, people can't digest properly. They got nausea, vomiting, and diarrhea because it's not going through the proper process of digestion because the pancreas is inflamed. It's other things that I'm gonna speak to you about, like called the ampulla of Veda. So the ampulla of Veda is also connected with the stomach, the gallbladder, and the pancreas. So most times, acute pancreatitis, the etiology usually is alcoholism and gallstones, because that duct that's right there between the two can be blocked. Okay, and y'all know what happens when shit get blocked. Shit start backing up. It's just like a car. You have to think of the body like a car, okay, or like anything with a pipe, hole, plumbing. If shit is blocked, shit can't get through, shit gonna start coming back out the wrong way. Do you understand? Bottom line, that's the big picture of it all. So then after I explained that to y'all, I also told you about pathophysiology. You need to know how to break these damn words down so you can actually understand a little bit about what you about to jump into. And then I also told you nursing interventions, what you're going to do as a nurse. Because on the NCLEX, let me tell y'all something. It's very seldom you're going to call a doctor. Because 90-something% of that test is going to be what you going to do. Because what you think you're going to come to work for 12 hours and not do nothing? Don't get me wrong. We got a lot of nurses here that sit on their ass and don't do shit. But guess what? Don't be one of them type of nurses. If you have acute pancreatitis, anticipate nothing in the mouth. Educate your patient and tell them, listen, you can't put nothing in your mouth. We got to rest the gut. Pain medicine as a priority. Pain is a priority over any of your other priorities, okay? Even though pain could be delegated, that's something else I'm going to talk about with y'all. Pain is a priority. You don't sit at the computer and just, hold on, I'm looking for something. I'm looking for something. I got to answer the patient. Bitch, why you still sitting at the computer talking about you got to answer a patient that's not in no acute crisis? Pain is a priority. You get your ass up from the computer and you go handle that first, or you delegate it, and then you come back to that. One thing that I have noticed with training new nurses, they're so task oriented to where they're not able to think about the big picture and think like, hey, I need to find out what's a priority. So I'm gonna teach y'all about prioritization, whether y'all like it or not. Because don't get me wrong, I get a lot of resistance. People get defensive and this and that. But guess what? At the end of the day, bitch, teach yourself. If you feel like you got it and you could be a competent, confident, effective, safe nurse straight out of nursing school, you don't need nobody to teach you, baby. Just go ahead out there on the floor all day in the hallway. Let's see how you handle that shit with no expertise from an expert. And not just saying me, just anybody who has more knowledge, understanding, and years of experience than you on the floor at the bedside. That's all I'm saying. So anywho, so now we just went through all that. What y'all think? Period. So now let's talk about the labs. I want to explain something to y'all. So these labs, any organ that's in the body, when there is a problem, pathophysiology wise, with that organ, is going to secrete something, an enzyme. Something is going to secrete it in the blood as an indication, as a marker, as a measurement to let us know where the problem is, where the origin of the problem is. Okay? So usually when a patient come in, they give signs and symptoms. They are their own historians when they can be, and they tell us their history. If they're a drinker, we kind of lead towards acute pancreatitis, especially if you tell us it's accompanied with nausea, vomiting, diarrhea. A lot of times, them motherfuckers could have fevers, temperature. Temperature is something sensitive. Just like the skin is a line of defense, fever, heating the body up, could be a line of defense. That's an immunity response. Sometimes people want to be so quick to say, oh, hurry up and kill a fever. Technically, if you talk to an infectious disease doctor, anybody, and that's their expertise, they will tell you, you don't want to bring them temperatures down too fast, because that shit actually helping killing the bug. You understand? Okay. Don't shoot the messenger, baby. Look, see Ashley at work. The nurse with the verse that curse. The nurse with the verse that's ashy at work. Period. Babe, I love you. You my everything. So anyway, let's talk about the labs. Okay. You're going to have lipase and you're going to have amylase. These are specific for the pancreas only. So when you taking a test, and it asks you something about any other enzymes that is secreted, you already know that's a process of fucking elimination, because that is not secreted from the pancreas, okay? If it ain't amylase and lipase, okay, thank you. So those will have an elevation. Sometimes I see doctors order lipase without ordering the amylase, but most doctors usually order both. And those numbers can sometimes be in the thousands, okay? Can be significantly high. So what we got them on the fluids for? To kind of help the gut rest and then get that shit on down. Send it on down. Send it on down. So other labs that you can see that are significantly affected can be WBCs, because remember, for any inflammatory process, there are going to be inflammatory markers, okay? So for your inflammatory markers, you're going to have SED rate, you're going to have CRP, and then for inflammation, also the eosinophils, basophils, WBCs, lymphatic sites. Y'all know what I'm trying to say. Y'all done learned some of these words before. So usually when you see these numbers are significantly increased from the normal baseline, that lets you know that there is some type of disease process going on in the body. So with that being said, sometimes some patients can be put on a broad spectrum antibiotic like Zosyn or vancomycin, but that's not in most cases. Most cases is nothing in the mouth, rest the gut, pain as a priority, and NS, isotonic fluid. I stay where the fuck you put me in the intravascular space at 125. You understand? Keep it like that. Don't try to add all that extra shit. So anyway, let's get into acute pancreatitis. So besides that, other things that occur is autodigestion. So basically what happens in autodigestion is, because I'm looking at my paper, yes, before y'all little motherfuckers try to judge me and talk about, oh, but she know it all and whoop through this and that. You know, people be hating. You know, the 48 laws will say never outshine the master. But I'm not trying to outshine no master. I just don't want to leave no nurse behind. And I don't want nobody taking care of people and you only know lit bits of what you're supposed to be doing. So, okay, autodigestion occurs when the pancreas produces enzymes that digest. Oh, yeah. It's a ghost in here. Yeah. And I was not stopping my educational. Thank you. Anywho, so we need to call somebody about that. Do we need to unplug it?
Yeah.
Because all of a sudden it just started spitting out some ice. So autodigestion occurs when the pancreas produces enzymes that digest its own tissues. So do you believe that shit be eating shit inside the body? Yeah, sometimes your body will attack itself. That's why it's called autodigestion. So go back to our medical terminology with prefixes, root words, and suffixes. Autopilot, auto meaning it's gonna do it, gonna do something, and digestion, self, digestion. It attacks itself. So when that happens, it causes inflammation, okay? And neutrophils is another lab that can also be elevated. And we're going to talk more about when we get into talking about hematology labs, because I'm going to do a video specific just about labs so y'all can know everything that goes with everything. But I'd rather tell y'all everything under the disease process so it can make sense to you and you can only look at those specific things. So WBCs, lymphatic sites, eosinophil, basophil, neutrophils, amylase and lipase, okay? SED rate, CRP, those are inflammatory markers. So what happens is the body is responding to something. When the body is in trouble, the body is automatically just gonna start shooting shit out and have an immunity response, inflammation, cytokines, prostaglandin, inflammatory mediators, all of these things. And I just told y'all the labs that are linked with the inflammation, okay? So you have premature activation and release of pancreatic enzymes in the pancreas. which leads to pancreatitis. So then another thing I want y'all to know is there's something called trypsinogen. So remember I told y'all learned about in chemistry when y'all talk about, oh, I don't even understand why we got to take chemistry because we never going to use this in life. Yes, the fuck you are. Trypsinogen actually turns on trypsin, okay? It converts into that. It's actually an enzyme. You understand? If a patient come in with gallstones, alcoholism, it actually blocks the gallstones, actually blocks the pancreatic duct. That's part of the reason why gallstones is the etiology for acute pancreatitis. So next, let's talk about diagnostic. So if something wrong with a patient's stomach, quite naturally, what you think we're gonna do? We're gonna take a picture of the motherfucking stomach. We need to see. So quite naturally, it's gonna be a CT of the abdomen and pelvis. So we could look inside there. I don't know how many views. I'm not no motherfucking doctor. That's MD stand for massive dirt. Period. So, depending on where the pain is, sometimes they could do a right upper quadrant ultrasound, CT of the abdomen and pelvis. They're gonna do blood work for sure. Everybody get blood work, and everybody get a chest x-ray. I tell y'all also too is about the vital signs. You can actually treat pain as a part of your vital signs along with the temperature. Some people could be febrile, some people could be afebrile. When I mean that, bitch, either you got a fever or you don't have a fever. Either you got a temperature or you don't have a temperature, okay? 38 degrees Celsius or 100.4. Anything great, anything that at that range or greater, that's when you treat. Low grade shit, you don't really have to give nobody anything for. And let me tell y'all something about that motherfucking acetaminophen, that analgesic, okay? If that medication is in the MAR, which is a MAR, a medical administration record, the shit where you looking at the medicines and you scan for your rights of administration, if it says that you're using that for temperature and you're actually giving it for pain and you chart it for pain, ding, you're going to jail. No, I'm just saying you're not going to jail, but that's another reason about how you operate outside of your scope of practice. You have to give the medication what it's intended for, and it has to say it in there. If it's for temperature, it says temperature. So what you should do as a proactive nurse, when you see that doctor, you should let that doctor know, hey, can I or you write an order for Tylenol, acetaminophen, to be given for temperature and for pain. Usually it's for mild pain, ranging from 1 to 3. If they have pain 4 to 6 and you give Tylenol, you're operating outside of your scope of practice. The patient needs to be assessed for a higher dose or a different type of medication to help manage their pain. Okay then. So temperature, heart rate, respirations, blood pressure, and pain. So pain gonna be elevated. Usually when pain is up and the impulses are going, the patient, you're gonna see slight elevation in blood pressure, okay? You're gonna see signs of grimaces, people moaning, people clenching, people guarding, things like that. Those are indications that the person is in pain. Usually if you could give the pain medication, it will help the blood pressure and it will help the respiration. Respiration, a patient could be breathing fast, tachypnic, because they're in pain, or some people could be shallow breathing. So everybody that have acute pancreatitis don't always have to have a temperature. So that's not something that you can always just go off of and look for as it pertains to acute pancreatitis. So another thing is, if it make it easier for you guys, another good way to study for these disease processes as it pertains to patho from A to Z, you can actually have the picture in front of you while you're studying. You can write on the picture, because I'm also going to do an ebook, but I think I touched on the importance of writing stuff down and how it actually helps the brain, how it cues the brain, and how you're able to store more things into long-term memory so you can recall them at the time of test taking as it pertains to your pathophysiology test and your fucking NCLEX. So I already went over the overview with y'all. I already went over, you see how I do everything in an organized form. I'm using the term chunking. Is a psychological term that I used during my psychology degree to help y'all motherfuckers be able to recall information. So when you chunk things together, it's better for recall. And when you organize things together, it's better for organization, and it helps you be able to perform safe practice on your patient. So I went through medical terminology with y'all, prefix, root word, suffix, the overview, telling y'all about the normal function of the pancreas, and then what happens when the pancreas become diseased. I told y'all about the pathophysiology of the pancreas as it goes through autodigestion, attack its own fucking tissue, become inflamed, secrete premature shit up in there to where the patient can't eat. And I already told y'all what digestion is. Digestion is hold a hole. You put some shit in your mouth, the shit come out your ass. Y'all got it? Thank you. So then I also told y'all about nursing interventions. Nursing interventions are 3 special steps, like special agent also, nothing in the mouth, NPO, rest the gut, same shit, normal saline, isotonic fluid, I stay well, I put you bitch, intravascular space. And then pain medicine, which is a priority. You don't sit at no computer saying you looking something up for somebody else and you trying to look at lab values when you got a patient that in pain. 1 or 2 things need to happen. Either you go medicate that motherfucking patient or you delegate it to another nurse to go and medicate the patient. Do y'all understand? So I also told y'all about clinical manifestation, pain, grimacing, fevers. Everybody don't have to have no fever. Nausea, vomiting, and diarrhea. This is what your patient gonna actually look like. Signs and symptoms that are presented when a patient come in with acute pancreatitis. Also check the history. If the motherfucker drank alcohol 9 times out of 10, the pancreas is tore up. And gallstones, that's another reason. So don't be out here just prejudging everybody, thinking when everybody come in that they're alcoholic. They could have gallstones too, which could be blocking the pancreatic duct. I told y'all about diagnostics. You're going to take a picture of that stomach so you can see what it look like, right? And what are those? Those are objective, meaning that these are the things that the doctor ordered that can actually be measured. Subjective is what the motherfucking patient tell you. If they say they're in pain, their pain is whatever they say it is. Y'all understand? We're not going to argue with that. We listen and we do not judge. So if y'all have any other questions about acute pancreatitis, I am also going to be offering one-on-ones for us to have Zoom study sessions, whatever y'all need to personalize these courses for you guys so that y'all could be successful in y'all nursing career. It's your girl, the nurse with the verse that curse. Sometime I'm ashy at work, but guess what it is? Also go by DNA, D Naked Author. I'm out. Peace.